It'll work. Okay, let me see if we made it. All right, we are live. Okay, now I just need a second to share this in a few places, and we'll give everybody a minute to join in. Lawrence, you want to sing us a song while we wait?
How about Ring Around the Rosie?
Yeah, how about not?
Right, you know what that refers to? That's a song about a plague.
Yep.
Ah, okay, I did not know that.
Then they're back in high school.
Yeah.
Chris, which version of Blue Jeans are you using? Because my trial period ran out, and so I think I'll have to buy the full version.
I'm not really sure. I'll have to look at it when we're done and see. Lawrence and I were just talking about that a minute ago. I don't know. I've had it for about a year and a half, and I don't remember. I think it holds up to 75 people, so whichever program that is. Uh,
Okay.
they had a few options. Okay, well, we are live, so we're going to go ahead and get started. I've shared this a couple places. We've got some people joining in. Hello, everybody. It's Uncle Grumpy, and welcome to Grumpy Tonight. As you can see, tonight we're here with our old friend, Dr. Lawrence Pasternack, and a new guest tonight. We've got a new friend, um, what is it, District 62,
Yep.
Oklahoma House Representative Daniel Pay. Daniel, why don't you say hi to everybody and tell us how long you've been in office and a little history.
Well, thank you, Chris, and hello to everyone watching on Facebook Live. It seems like we've all become used to using this as the vehicle for getting the word out to folks around the state. In our part of the state in Southwest Oklahoma, Senator John Michael Montgomery, Representative Trey Caldwell, and myself have been doing this for our constituents. And so I personally represent House District 62. That covers Lawton proper, specifically the west and the south side. And I've been in this position for 2 years now. So I'm a freshman, one of 46 who were elected to the House of Representatives. And it's been a tremendous experience overall, getting to work in the policymaking arena. I started off as an intern a couple of times back in college when I went to OU at the state capitol. So that's when I became familiar with the procedures and how to turn a bill into a law. And Chris, it's been great to work with you as well as Adam on trying to get the Oklahoma Credit and Consumer Protection Act passed. We got that out of the House, and then obviously things change right now. It's over there in the Senate. But I'm glad to have met you through this experience and then continue working with you on getting that across the finish line.
Yeah, yeah, I've seen you've moved a couple other bills since then as well. What have
Mhm.
those been about?
So my governing philosophy is like riding a bike. I don't think you should lean too far to the left or too far to the right. I think you have to be balanced. And so I look at what are good, common sense, sensible policy ideas. So another one came from a constituent. She did some research on a Texas law that for any school district with a certain number of military connected students and resources available for those students, they can be designated as a Purple Star campus to build morale and to build a brand for incoming military families. So certainly Lawton could use that. I think Enid, Midwest City could be also other candidates for that type of designation. And then had a carryover bill from last year dealing with DHS and for any investigation into a child care facility, that be complete within 45 days, unless there are any extenuating circumstances. And then had a couple bills related to the crisis of missing and murdered Indigenous people. So the bill that passed out of the House, it would add in the CLEAT training for law enforcement officers about this particular issue and how to help the family members of those who've gone missing or murdered in the Native American community. And then the other bill I'll highlight is actually a bill from Representative Carol Bush, but she passed it on to me. It dealt with increasing the penalty for human traffickers. And another bill that we've been working together on, along with a few other legislators, is creating a harm reduction program right here in Oklahoma based on what a number of other states are doing. And that would be an opportunity for people to exchange used needles and then also get substance abuse services. We have an epidemic of needles as well as not hepatitis and then HIV. And so I think this can be a great program that helps many, many people out and to get them assistance in the long run. So those are some of the things I've been working on, and hopefully whenever we do get back to the Capitol, we can get some of those finished this session. If not, we'll take care of it next session.
Great. Well, that's great. That's a lot you got going on there. And I have to point this out. You're one of the youngest people up there, are you not?
I am the youngest. That's
You
correct.
are the youngest. I
Youngest,
love
yeah.
seeing I love seeing when people don't do like I did and wait till they get over 50 before they get involved with government. I appreciate seeing you in there at your age.
Absolutely. Yeah, well, I'll be 25 later this year, and I think it's good that to have young people involved in the governing process. And so I've been enjoying the mentorship opportunities I've gotten with high school students and college students, and telling them, if you want to get involved in politics, go for it. As long as you're willing to work hard and have a positive attitude and serve your community, you can do it.
Yeah. Yeah. Okay, Lawrence, we haven't seen you on here in a while. Why don't you say hi to everybody and tell us what you've been up to?
Well, hello, everyone. I have been busy with work. Many of you know that I'm a professor at Oklahoma State University, as well as that last year I became the director of religious studies at OSU as well. So the religious studies program basically was shut down in the 1990s, and I and others have been trying to revitalize it. And I chaired a search committee to hire some new faculty, and then was appointed the director of the program. So a lot of my time over this academic year has been focused on furthering that program. We've hired some more faculty. I've doubled the number of faculty, and working on a lot of changes for the curriculum, having lots of guest speakers in, and everything budgeting and staffing and lots of administrative work related to that. Ongoing constant research for me. I finished sort of a timely paper in a sense, even though it dealt with a work from 1791. I dealt with the paper on the problem of evil. Namely, how could there exist a all-powerful, benevolent being while evil exists in the world, unjust suffering, disease, death, and so on. So I have a paper that I recently finished on an understanding of the nature of faith in relationship to the problem of evil. That's for a German press. And I am almost finished a paper on, how do I describe it? A paper on the social institutions needed for world peace, paper on that topic. I was supposed to, and I was getting ready for a trip to Princeton, but that's gotten canceled. I just worked with Cambridge putting together at least a proposal for a volume on the problem of evil. So keeping myself very busy with my typical writing projects, and like I said, a lot of new administrative work on my shoulders since I became the director of religious studies.
Well, between the two of you, I feel like I've just been a bit lazy. I don't have a story anywhere close to that. All right. Well, let's get started then. Okay. Thank you both for being here. I appreciate it. I'm definitely lucky to have two people like yourselves take the time to come on and talk to me and to those that want to watch here about what's going on. Representative Pay, I'd like to talk to you a little bit about what, as far as this virus and your district, what you said you and a couple other representatives were doing a similar thing using the same app we are here. I've seen you guys doing that. What is it you guys are telling everybody to do, and what information are you guys sharing with your community, and how are you getting ready for this?
Absolutely. I think that's one of our important responsibilities as representatives and senators is to be the conduit for getting information, especially stuff that's happening at the federal level, down to the folks on the ground and the constituents who need access to important resources and information. So, in addition to the Facebook live updates, I've also been posting daily updates on my personal and official pages, as well as sending those via email to the list of email addresses I have for constituents. So all that, trying to get a lot of transparency out there. And so when it comes to Comanche County specifically, as of this past weekend, we have about 6 confirmed positive cases, no deaths. A large percentage of those cases are at Fort Sill, which is directly north of Lawton, and so that's another thing that we have to be considerate of is we have both in the community area and then in the military area potential for these cases. So what I've been emphasizing, as well as the other members of our delegation have been emphasizing, is to follow the CDC guidelines. Make sure that you're staying at home unless you have to go out for essential errands like buying grocery or getting medicine at the pharmacy. But staying at home and making sure that you're practicing good hygiene, whether it's washing your hands or not touching your face when you sneeze or cough. That's ultimately how we can get out of the situation. I know Lawrence will talk later on about the projections as far as how when we'll hit the peak number of cases. But even after we hit that peak, I think it's important that we all make sure that we're still being abundantly cautious and practicing good hygiene and following these guidelines, because they'll, I think, lead to better outcomes that way. But I've also been in close touch with our city leadership. I know that they've been needing assistance getting the word out, and particularly the clarification on some of the governor's executive order, like what is exactly an essential business and what's not, as well as our school leadership. And, we're going to have distance learning and in formats like this via online learning here in the next few weeks and months. And so that's going to be an adjustment for our kids. And so I've been doing my best just to make sure that I'm available to answer questions. If I don't know the answer to a question, reaching out to folks in state government as well as our federal government and trying to get the answers that people need.
Okay, how many cases did you say you had in your district?
As of this weekend, we have 6 confirmed positive cases.
Okay, how are the hospitals doing in your area as far as capacity and things like that,
Sure.
and stock and this personal protection equipment, PPE? How are they doing on all that? I'm betting you're talking to them, aren't you?
Yes, and we opened up a drive-through testing clinic here a couple of weeks ago, and so we've been conducting tests and trying to get people evaluated that way. And like other communities across the state, yes, we do need more PPE. We do need more of those ventilators and masks and basic supplies in order to help our medical professionals. And I think we all anticipate that the numbers are going to continue to increase as testing increases at the same time. I am encouraged that Congress did pass the CARES Act, and I think that includes funding for hospitals and for healthcare providers, small businesses, and so I think that's going to help us tremendously, not to mention the direct payments that will be given to Americans here in the next few weeks. I think that's going to help us get through this storm in the long run.
Okay, your video's gone out a couple times, but the sound has stayed just fine, so we'll just keep going. There, you're back again. As long as the sound stays, we'll just keep going. Specifically, do the hospitals in your area have enough PPE right now?
I would say they could use more. I don't think anyone in the state has sufficient numbers of PPE. I think as far as testing kits, we're getting there. I know that the governor announced that we have about 10,000 testing kits that were sent to OSU, and that there's more coming for the rest of the state. And then he also mentioned that we have a order of 1 million PPE coming in during the next couple of weeks, and we should get a couple more additional shipments. So any more that we can get will help the situation tremendously.
Okay. Lawrence, if you have any questions about his district, hop in at any time.
Uh,
Um, Go ahead.
oh, while Representative Pay was talking, I was just putting together some charts.
Okay. Okay. Now, I know Lawrence is going to start talking here shortly about some of these numbers. Let me ask you, as a representative, I'm assuming this is probably daily, but I'd like some confirmation. How often are you guys getting updates as state representatives, and how on top of this do you think we are at this point?
We have been getting updates on a daily basis from the state capitol. I'm grateful for everyone when it was the health department or in the governor's office or even on the weekends, just sending us updated data on the situation. So we're getting up to date information, and of course, I've been very happy with as far as the response time. If I have emails or phone calls I make, I get a response back pretty quickly. So I think there is that available. And then we've had weekly conference calls with the governor himself, and he's been giving us updates. And even though we're not working physically at the Capitol, it seems like we've just been as busy trying to get all this information together and then using social media and then other formats in order to get the word out to constituents. So as far as overall about how we're doing, I wish there was a little bit more, to be honest, a little bit more consistency when it comes to what's happening at the state level versus these municipal decisions. We saw this past weekend that Oklahoma City and Tulsa, they both declared a stay-at-home, shelter-in-place declaration. Not every city is doing that, and not across the state. And so I wish there was more consistency, which I think the governor, I hope they recognize at this point that there's got to be some more consistency as well as more clarification in order to make sure we get as many people to take this as seriously as possible, because this is a serious situation, and the virus has to be taken seriously by everyone, and this is how we can get out of this situation ultimately.
Okay, let me ask you honestly, do you really think we're taking it serious enough? Because I got to tell you, in my experience in the last few days, I've had to go to the pharmacy to pick up medication that I have to have, or I wouldn't have gone. But I've gone, and I've noticed that every day it looks like a Saturday at Lowe's.
Mm-hmm.
And I'm wondering, and I see when I had to stop at the stores I did have to stop at, I see parents walking around with their kids in tow, and everybody's out in their summer clothes, scrolling
Yep.
around looking for flowers and working on their garden. And I live in what I think, it's Oklahoma County. Don't we have the most cases of anywhere in Oklahoma
Yep.
right now?
Yes.
And Mustang, which is where I went to shop, is just 3 miles down the road. Is where it looks like every day is vacation day and everybody's shopping. It looks like Labor Day.
Yeah, well, and then a couple weeks ago you had spring break, and it was bothersome to me that in some of the news reporting you had the students saying, spring break's only once a year. I already bought my plane tickets. It's a big deal for me to go to Florida, and many folks have tested positive. The ones who went
Yeah.
down to the beaches, and so I think more and more people are starting to take it seriously. As, for example, businesses are shutting down and schools are shutting down. There hasn't been this response, at least in my lifetime, to any type of pandemic. So I think people are starting to take it seriously, but even more people need to take it seriously and stay at home to the extent as possible, unless you have to go out for essential needs.
Yeah, I definitely need to stay at home because there's no way I'm keeping my hands off this beard. It just isn't going to happen.
Yeah. You
Okay.
shave it.
Well, yeah, right. We'll pretend you didn't say that.
Yeah.
Time to kill his mic. No, I'm kidding. Lawrence, why don't you give us some numbers here? We've talked about what the government's doing, what we see out there. Now, tell us some projections here and what you've been researching.
All right, I'm going to screen share. I have just a whole bunch of tabs open, and I'm going to sort of jump around from them. So hopefully this will work. You guys might just have to tell me if you're seeing it. I can't say for sure, but
Yes,
I just
I got
thought
on my
I'd
end.
start off with somewhat of a dramatic picture from China of a hospital ward. Um, so just one thing I wanted to say is that just like Chris was mentioning, and my wife observed this as well today, that she passed by a neighborhood park that even though the city parks are closed, my neighborhood has its own park, and there is a whole bunch of people playing basketball with each other, no social distancing. And so some people just aren't taking it seriously. And some people just feel they're young and healthy and it's just not an issue. And if you are young and healthy, then, the odds are in your favor. But that doesn't mean that you won't get another person infected. So, China has been able to manage its cases through pretty severe measures. In Wuhan, for instance, my understanding is that they had everybody wearing a bracelet. They were constantly monitored. They were basically those bracelets were scanned. All their movements were mapped out. If anybody ended up showing symptoms, then they'd be able to go to the database and look at the database to see whoever they were interacting with, and then sequester those individuals. I heard that Israel is doing the same using, all of our cell phones have a unique IMEI number. And so just as people would suspect that the NSA and so forth actually could, in theory, track us all, well, government agencies can do that. And Israel has been using it likewise for that purpose. So, so far as I know, our government is not doing things like that yet. But that depends in part on us. That depends upon our maintaining that social distancing. And what you see here in this picture from Wuhan, in a way, is maybe kind of a better case scenario. Those of you who've looked at pictures from Italy, they're much, much, much more grim. And a reason why is because, and now I'm going to move to another chart. It's basically because of this, and probably a lot of you have seen graphs along these lines, where if we didn't take any countermeasures at all, if we didn't engage in social distancing or use other ways to try to mitigate the spread of this virus, then it would spread fast enough that our system would become overloaded. So I've seen numbers anywhere from 1% to 3% mortality rates. I think in the United States, in terms of cases that are tested positive, I think there's roughly about a 3% mortality rate. In Italy, the mortality rate was over 10%. Over 10% of everybody who contracted the virus died. That's just an extraordinary amount.
Why was it so much different?
And the reason why, I'm getting an echo. I don't know why. But the reason why is because Italy did not, at least in time and to the extent needed, they did not develop, and the population didn't follow the countermeasures. They didn't socially isolate. And so the virus spread through their society to a point that basically the system got overloaded. So imagine, for instance, see where it says 10,000. Imagine if, for instance, the handling capacity of the healthcare system, that's the number of hospital beds, the number of doctors, the number of ICU beds, the number of ventilators. If you exceed that number of cases, particularly of severe cases where people do need to go to a hospital, then if the hospitals are full, which is what happened in Italy, people were lined in the hallways, right, getting treatment. And beyond that, they couldn't even fit the people in the hospital. And they opened up, indoor gymnasiums and so forth to try to house the people who are sick. But the problem is that if you don't have enough ventilators and if you don't have enough doctors for everybody to get treatment, the people who don't get treatment die.
Okay,
So
so
that's
what you're
basically
saying,
what happened in Italy.
so what you're saying is, if we have the equipment, it's not that difficult to keep the percentages of death to a low amount. But if the second you run out of equipment, that percentage starts to immediately climb.
Yeah.
Okay, so
Yeah.
let me ask you, Representative Pay, let me ask you, what is the state saying about when or if we will hit capacity with our hospitals?
I'd anticipate that we're just like other states who are estimating the early part of April. If we do absolutely nothing, we could hit that critical point. And then I think the president, before we got on here, at his
Well, he cut out.
yeah, someone was calling me, but I think he announced that we're looking at about a 2 week period to hit the actual peak number of deaths. So we'll see what happens. Let's have to take it a day at a time.
Let me turn to a chart on that issue, if I may.
Yeah, go ahead, Lawrence.
So those of you who want to look at some of this data, the website here is covid19.healthdata.org. You may be able to see the URL. This and another website, covidtracking.com, I think are among the two best. And so I want everybody to think about this. We have about 4 million people in the state of Oklahoma. Guess how many ventilators we have? We have 500. We have 500. We have 500 ventilators for 4 million people. All right?
Okay.
All right. And so the data basically is that between 10 and 15% of everybody who comes down with this virus ends up with sufficiently severe symptoms that they have to be treated in a hospital. Okay. So in the case of the seasonal flu, 50% of the population, in a typical seasonal flu, 50% of the population could contract that flu. So if we did nothing, imagine we had 2 million people in this state coming down with the flu. And given the severity of the symptoms here, we would be looking at, say, something in the ballpark of 200 to 300,000 people having to go to the hospital. A relevant percentage of those would need ventilators. So in theory, 100,000 to 200,000 people, if some people may not need ventilators and some people might but still have to go to the hospital, 100,000 people for 500 ventilators. That would be the potential situation for Oklahoma. And I'm going to turn to another piece of data here that I want people to take note of. That when you look at the national data, currently we are at, in the United States, about 140,000 positive cases with about a little under 2,500 deaths. So that's a little under 2%. So the mortality rate right now we're looking at across the United States is a little under 2%. Here's the mortality rate in Oklahoma already, with only 429 cases in the state of Oklahoma. We've had 16 deaths, right? We've had nearly double the mortality rate, or slightly over double the mortality rate in the state of Oklahoma than we have had in the nation.
Well, do you think, okay, I'm sorry, I don't mean to interrupt, but do you think it's possible that that number itself is high because the limited testing we've had so far, and that the numbers are going to really be off until we get a significant number of tests to be pulling an average from?
So, right. So one thing that I definitely agree with is that who's going to get tested, right? We're not going to have basically what would be called a statistically representative sample, right? We're not going to get a sample that's going to represent all the variations in the population. We're going to get a very biased sample because most of the people who go to get a test are the people who are showing more severe symptoms, right?
Okay, wait, hold on a
But
second.
that's the case
hold on.
around.
Hold on, I'm sorry. Representative Pay, what is the order for how you get a test right now?
Right now, I believe it's if you have symptoms.
But who decides if you get the test or not? Is it you, or because I saw a thing on earlier that said you had to call the number and they would determine if you got a test. So who decides if you get a test or not? You, your doctor, or that number?
Well, either or. You can call that hotline, or you can visit your medical physician to get a diagnosis and a testing.
All right, go ahead, Lawrence. Sorry about that. I need to know that, though.
But you're completely right that these are not representative. This is not representative sampling, right? That it's highly skewed because pretty much the people who are getting these tests are the people who are already showing significant symptoms. But that's true both in Oklahoma and around the country, right? And so I don't have the explanation for it. It might just have to do with issues of poverty, issues of the distance that people might have to travel to go to a hospital, that were more rural than some other states. I don't know. But right now, at least, and the numbers are small, right? And because the numbers are small, right, we're going to have a greater margin of error. But right now, at least, we're looking at about twice the mortality rate. And hopefully that's going to even out. Hopefully Oklahoma's not going to end up in one of the worst conditions. But I looked at the data across all the states, and it may be the highest mortality rate or one of the highest mortality rates so far. But the numbers are small, right? We only have 4,000 cases. New York State has something in the order of 60,000 cases. And I don't know exactly where that comes to per capita, but nevertheless, right, because we only have 4,000 at least tested positive cases, 400 tested positive cases, then, Oklahoma looks like it's at this point, comparatively much safer than a lot of other places in the country, but we got to keep it that way.
Okay. Hang on. Before you go any further, Representative Pay, I don't know if you can see, I don't know if you've got two screens that can see what they're saying on Facebook or not, but definitely want you to go back and read it. Some of them have some messages. One of them is that they hope you take back from this that a lot of people aren't taking this serious enough, and that some of the, as you said, not all the towns have the same orders. What did you say? Yeah. Your district? What's your district under? What orders is your district under?
Well, because based on the governor's executive order, if you have confirmed positive cases, then you will have non-essential businesses closing, as well as if you're a vulnerable person or have underlying health conditions, stay at home. So we're under those criteria because we've had positive cases now. And the mayor of Lawton has issued a state of emergency. And so we have additional restrictions on the types of businesses that can and cannot be open.
Okay. All right. Lawrence, can you tell us there with your statistics what you think as far as when we're going to peak in the state and what's going to happen here?
Sure. Let me screen share again. And so the modeling that I've been looking at is predicting basically the middle of April 17th, as a pretty much the peak for the state of Oklahoma. Let me see if that's true for other states as well. They're looking at New York as peaking sooner, April 6th, which would just make sense given just how, the virus spreads across the population. On average in the United States, April 14th. So in theory, at least, we're looking at the peak coming in a few weeks for us. Let me go back to Oklahoma. And so this is optimistic, of course, and this is based upon the expectation that people follow basically the government's instructions. So if people follow the government's instructions, then we will be able to stay within the existing capacity we have for hospital beds, right? But that's predicated upon our doing that. And I want to show a related piece of data here. One thing that's really important, that's worth everybody paying attention to, covidtracking.com. You can compare the day over day doubling rate. So if you were to go back about a week and a half, then the doubling rate through the United States was about a doubling every 2 days. Now we're looking at a doubling rate that's less than every 3 days. And so the longer that doubling rate is, the better. That's a really important indicator as to how well we're handling it. And the fact that we've had a 50% increase in the doubling rate over the last week says that the policies that we're utilizing right now are helping. But we realistically need to get that doubling rate down a lot more. But right now, basically, what you can do is you can do this. Here we are on Sunday, March 29th. You go back 3 days. There were 240 cases on Thursday. There's 429 cases on Sunday. right? And so what do we have here? We have a little bit better than a 1, 2, 3 doubling, 3-day doubling rate. And so if you go farther back, now again, this is dependent upon testing, how much testing you're going to get, you're going to get variance because of that. But if you go farther back, then we could have faster doubling, and especially with a larger sample like across the United States, you could see it more.
Okay,
So,
Lawrence, I've got people asking where these numbers are coming from. Can you just share where you've gathered all your information from, please?
so covidtracking.com, and what they do is they get their information from the departments of health from each of the states. So they report on where they actually get their data from for each of the individual states. But covidtracking.com, the COVID tracking project, it's something that I check every day. They update around 4 p.m. Eastern time every day. And so every day the hope is that the doubling rate slows.
Okay, now hold on a second. Representative Pay, can I ask where you guys get where the government gets where are you getting your information from? And do the numbers sound similar or the same as the numbers that Dr. Pasternack's giving us right now?
I think the numbers do sound similar, and we've been getting our data from the folks over at the Oklahoma State Department of Health. And so they send us every day around lunchtime, 12 p.m., the updated numbers as far as how many cases there are, how many deaths there have been in the past 24 hours. And even on weekends, we're getting that data.
Okay. Yeah, you guys are probably working more now than you did before. But hey, you get to take a break from driving.
That's right.
That's the one thing. Everybody gets to do a few less miles. I heard somebody say something about 98 cent a gallon gasoline earlier
in Oklahoma
today.
City somewhere. Yeah, I think we're down to about $1.50 here in Lawton.
Now that's gonna be great for those of us that have to drive around, but that's gonna kill the state economy. Our budget is based solely or too much on oil. So I'll throw this at you. I think now would be a really good time for the legislator to pass a full access or recreational cannabis bill. So when this virus is over, we have an industry that can pull from surrounding states and help with a faster economic recovery for our state. So there you go. Just came up with that. There you go.
Well,
see if we can make that happen.
Yeah. Well, I definitely believe we need to diversify and invest in renewable energy. I had a great intern study last October on solar energy in particular. I think we have a lot of potential in that area. So hopefully we'll get more diversification here in the next few years.
Great. Lawrence, what other numbers you got there you want to show us?
Well, let me put up some more data. And I also actually want to say a couple things that are cannabis related too, but we'll hold off on that.
Okay. We're going to go 15 more minutes.
Yep. Okay. So here's just another way of representing the situation. And so what's the doubling rate? This is from a few days ago, this data, but here it shows that basically the United States has been doubling at a rate between 2 to 3 days. And the United States now has more cases than any other country in the world. We've exceeded the number of cases from where it started from in China. All right. And one of the reasons why is because obviously there's so much travel into the United States and, how urban our population is, and then just aspects of our healthcare system and so on and so forth. But, we could potentially become, we could potentially become like Italy. And so, Italy doubled at a rate fast enough. Here's Italy here. And you go back to where Italy was a few weeks ago. And so they had a doubling rate greater than every 2 days, and they slowed it down progressively. But they got hit so fast, right, that a lot of people who didn't need to die ended up dying. And Oklahoma might be a little bit more fortunate. We're more fortunate than New York City, for instance, in terms of the spread of the virus. But I think that the real serious worry that we have is that unless people follow the government's instructions, unless people self-isolate, unless people are extremely cautious, when you go out, try to not get close to people. If you have gloves, wear gloves. If you have a mask, wear a mask, and do everything that you can. When you get home, wash your hands. When I get a package sent to me, I will either use gloves to open it up, all the packaging, because whoever put that item into the box, who knows if they had the virus on them. And I will get rid of all the packaging and then take my gloves off. Or here and there, sometimes I'll just wash my hands thoroughly afterwards. All right? Mail, right? Because the virus could live for about 3 days on most surfaces. So something that goes through the mail, some package that you get from Amazon or who knows whatever, could have the virus in it. And so, it's not just you're going out of your house, it's also what's coming into your house that you have to be aware of. And when you look at the mortality rates, something in the order of 15% of people over the age of 70 who contract the virus die. All right? So if you're elderly, if you have underlying health conditions, if you interact with the elderly, it's especially important. You need to wash your hands, you need to wear gloves, you need to socially distance, be cognizant of your mail, be cognizant of the packaging that you have that comes to your house, and so on.
Okay. A little doom and gloom there. I hate it, but that's where we're at. I guess that's where we're at. We definitely are in a different world than we were just a couple months ago. Representative Pay, let me ask you what we're doing about this as far as getting legislation passed. As you said at the beginning, we were working on a bill together, and right now that's currently not a priority, so it's probably not going to get a lot of attention in this emergency status, and totally understandable. But there are other things that are a priority, like the home delivery for cannabis. And I think what should also be attached to that is the residency bill, removing the residency from the card, residency requirements from the card, again, for faster economic recovery when this is over, so that people from other states will be able to participate in our program. I think those belong in any emergency bills that aren't necessarily emergencies, but I know we're going to do the budget because you're constitutionally required to do that.
Mm-hmm.
And I know there's going to be a few things that get through, some bills that are, in fact, I'm betting you guys end up having to overlook the single subject rule a little bit just to combine some of this stuff.
Sure.
But is that not the plan?
That is, yeah, I think that's a good description of the plan. Certainly budget's going to be number one, and
Right.
even before COVID-19, we saw a decline in oil and gas prices because of the price war between Russia and Saudi Arabia. And so that was already negatively impacting the forecasted budget for next year. Now, fortunately, a year ago, we were able to have a fiscally responsible approach and put about $200 million back into our savings accounts. So heading into this difficult period, we'll have about $1 billion worth of both the rainy day fund and the revenue stabilization fund. And that's what we'll utilize to finish off fiscal year 2020 and then heading into fiscal year 2021 in order to avoid any drastic cuts to core services, which is something that none of us want to see happen. And then I think we'll have probably a handful of emergency-related bills that have to pass no matter what this session. I anticipate, based on the feedback that we've all gotten the past couple weeks, one issue that will be tackled is the support staff within the public schools and making sure that they're properly compensated and putting that into statute. That is a guarantee, because we have many custodians, secretaries, financial staffers, you name it, who oftentimes get overlooked and don't get a lot of credit for the hard work that they do. And so I want to make sure we give them the support, the financial support that they need, especially in this challenging period of time. But we have no indication quite yet when we'll be physically back at the Capitol. We're waiting to see the conditions as far as having larger groups of people in one room. And so, definitely before the end of May, we've got to get it done. And, we have some contingency plans. If we're not able to meet in person by then, We passed some rules before we left here a couple weeks ago in order to allow for under extreme circumstances proxy voting. And so we hope that we can come back to meet physically in person to get the budget done and the other bills done. But if we need to, we have a backup plan just in case. So it's going to be a thorough evaluation of the health conditions before we're able to come back to the Capitol. And even after that, I think, Lawrence, we were talking before we went live just about the comparison between this situation and then also back in the 1918 flu pandemic, and looking at how perhaps we'll hit the peak in the next couple of weeks, and then with the summer coming on and the higher temperatures, that'll subside. But then going into the fall and the winter, perhaps this can make a comeback. So that's something to keep an eye out for, and to make sure that we're constantly practicing these good hygiene practices and things like that.
Well, I want to say again that when you go to that table talking about the budget, I've always been bothered by the amount of taxes we pay on medicine, be it cannabis in Oklahoma. So I'm at this point, I'm sick of everybody in the state looking to the medical program to save all the financial problems. So you guys are going to need some revenue. The oil and gas is obviously going to be an issue right now. I think this is a great time for our representatives to step up and to pass a full access bill through the House so that we have a faster economic recovery when this is over. When this is over, if we can come out of this with money coming in from other states, we will recover so much faster than if we just sit on it. Lawrence, you were about to say something?
Yeah, maybe a couple things. One is concerning the analogy to the 1918 flu pandemic, where I forget the numbers, but tens of millions of people died around the world from it. That it subsided in the summertime, then it came back in the fall even worse. So, we are weeks away from, we don't know how basically our social isolating will unravel. That is, what's going to happen in a few weeks or a month from now as they start to lift all these restrictions. There's a good chance that as they lift the restrictions, we end up seeing some flares, right? The numbers might go up again. It being summertime, they may not go up too much, but it's nevertheless, it's not as if we're simply just out of the woods and everything's fine. That, come May or come June or come July, as we start to normalize, we still have to be careful. Because in the 1918 pandemic, more people died from the second flare-up than from the first instance. And so viruses mutate. And so it's always possible that this COVID mutates into something innocuous or more virulent. We just don't know. And so, as the government says, okay, we can go back to work and so on, that doesn't mean stop washing your hands. That doesn't mean stop being cognizant about, if you feel ill, about surfaces that everybody touches and needing to not touch your face until you can wash your hands and so on. Things are different, right? We just need to be aware of that.
And then, Lawrence, are we looking at about 12 to 18 months as far as a particular vaccine being developed for COVID-19, looking at the research and that?
I've seen a few different possibilities because there's a few different approaches. And there's also the issue basically of how long it takes until the vaccine could be widely available. Because in theory, you could make a small amount of vaccine pretty fast, right? So there are a few different ways to make a vaccine. What you can do is you could take the virus, you could put it into a chicken egg, it mutates to be able to spread within that chicken egg, but that version of it that our immune system will still be able to learn from, but it won't hurt us. So that's sort of the classic way. But then there's other ways of doing it. There's basically stripped down versions of the live virus. There's versions of the virus that aren't live. And then there's also RNA-based vaccines. I don't know which ones they're going to end up using, but the mass production basically is the timeline that, in theory, somebody could potentially get vaccinated with something that is untested in a matter of days. But to have it fully tested and to have it fully available, months. But it also depends on resources, right? How much government money is going to go to labs, to universities, to scientists and so forth. And I imagine that we're looking at a situation where it's going to be a high priority. So maybe it'll be much less than 12 to 18 months, maybe. Maybe we'll see a vaccine in just a few months, maybe.
Are you, Representative Pay, are you hearing anything about that from out of the government? Are they saying anything about that at all?
We haven't heard any specific information on the timeline for vaccine development, but I'd imagine that it's going to be a high priority. I know that they're doing some research and experimentation on possible vaccine solutions. So hopefully we'll have a breakthrough sooner rather than later.
Okay. All right. Well, we're going to wrap it up here in just a minute. So, Representative Pay, if you don't mind, again, would you please just remind everybody the area that you represent? And I would like to say that I want to ask you to please continue doing these Facebook things you've been doing, not just with me, but the thing you guys and your colleagues were doing already, because I see so many conspiracies out there, and the only way to fight the conspiracies is with some real facts, and we need that on a regular basis. So I certainly appreciate that. But
Absolutely.
Go ahead and tell us again.
Yeah, and I strongly believe in elected officials being transparent and accessible and approachable, and that's what I've done since day one. So I'll continue to do these Facebook videos and then make sure to regularly contact constituents about relevant information. And so we're down here in Southwest Oklahoma, House District 62. That's West and South Lawton. This is my hometown, and I'm very honored to be able to represent the good people of Lawton down here.
Okay, Lawrence, anything you'd like to say before we wrap it up?
I have a lot of other things I could say, but I think it's time to wrap it up. So.
Okay. Well, I want to thank you both very much for coming on here and doing this. I really mean it. I'm honored that you guys would take time to do something like this with me. And, so are the people that are watching this really appreciate it. I've seen a lot of questions, most of which I think we can answer pretty easily. I'll get to those here once we get off. I want to invite you both back again soon. Lawrence, let's maybe do this again next week. Sure. Like you said, we're in a different world now. Representative Pay, you are welcome here anytime. Keep doing your feed. I'll keep sharing your feed like I did the other day, and let's just do our best to get the word out. And please, maybe, if you don't mind, message me tomorrow after you guys accomplish whatever arrangements you accomplish so that we have some clue as to our best plan of attack to get what we need, because I meant what I said. What we need is House Bill 3227 and 3229, both put into 3228, which already has an emergency clause on it. And that would be, as I was saying, there might be some overlooking of some single subject rule, but I imagine you guys will be doing a lot of that. But those are all important issues which will help the businesses and help the state recover and help the people that are stuck home right now. So those are all real important. Okay, guys, thank you very much. Stay right there while I close everything down. All right, folks, that's it for now. We'll do this again soon. I think Representative Eccles will be on tomorrow night. We'll get an update and see what the state did on Monday and maybe get some more answers as to where we're going with this. Lawrence, please keep watching the numbers, and we'll have him back on to talk about the numbers. I've seen a lot of you ask where the numbers came from. He's mentioned that a couple times in the video. We will also put that in the comments below so you can find that. So maybe he'll even put the link. So, all right, folks, that's it for now. Until next time, stay grumpy. I'll see you on the road.
Bye.
See.